I'm a clinical psychologist. I'm licensed in Colorado, and I have a very small private practice where I see primarily kids and adolescents, families, and couples. Clinical psychology is actually the application of the theory of psychology, and you're applying it specifically to a patient population, people who might be struggling with severe mental disorders, behavioral problems, or just general struggles in life. So it differs a little bit than research psychology or academia because you're primarily working with patients, people who are struggling, and you're primarily working with diagnosis and treatment. So there's lots of different areas of clinical psychology, but it generally doesn't include research or academia or some of those other areas that are more academic, I guess, in nature. I have quite a few kids right now with varying ranges of age that are struggling with anxiety, specifically school anxiety, but it also pops up in other areas as well. And I'm not sure if I'm seeing more of this just because teachers and professionals in schools have been a little bit more sophisticated in catching these kids, or parents are more motivated to get outside assistance, or if it's because maybe it's trickling down a little bit from the anxiety that adults are experiencing right now with the economic turndown, unemployment, financial stress, things like that. You want to teach kids how to manage their anxiety so that when it pops up in other areas of life, they're like, oh yeah, I know this feeling. I can use such and such tool, deep breathing, relaxation, going to my peaceful place to manage anxiety so that it doesn't become so overwhelming that I'm paralyzed and I feel like I can't go anywhere or do anything. Typically, and as for me as well, typically you'd earn a master's in counseling, or clinical psychology, or a doctorate in clinical psychology. That's typically a 4-year program and then an internship or a fellowship after that if you're interested. And then most states require ongoing continuing education, particularly in your field of study, so that you are up to date on new theories or new techniques and new strategies that are coming out in the field so that you can stay on top of it. Well, certainly I think in psychology just in general, but especially in clinical psychology, you need to have good people skills. You can know the theories of psychology in the textbook and kind of the classic presentation of a specific syndrome, but if you don't have the people skills, the social skills to interact with people and help them get motivated to change their lives, then you're going to feel really stuck, I think. And the other thing I would say is that it needs to be a person that is good about setting boundaries with people so that you're not bringing home your clinical work into your home environment and you're able to keep yourself healthy and keep yourself well as well so you're not taking home other people's problems. The great thing about this is that there's so many different things that you can do with it. Certainly I went the private practice route, but prior to being in private practice, I was a clinical manager for a residential treatment center for children. Some psychologists choose to work in community mental health, so they're working with patients that are underserved, economically underserved, or struggling financially. Psychologists can work in hospitals. You can work in psychology. There's a field called industrial organizational psychology in which a psychologist will work with a large organization or a large company to help them increase productivity and employee happiness or welfare. There's also a lot of new areas in disaster psychology where teams of psychologists will go out to disaster areas such as Katrina or earthquakes, things like that, to help people manage the stress and the acute trauma that they're experiencing as a result of a disaster. So those are just a few examples, but the great thing about clinical psychology is you can kind of make it what you want to make it. In my private practice right now, we're starting to work with a lot of couples that are dealing with infertility and miscarriage. So you can kind of find a niche that works for you. There's a lot of great aspects of clinical psychology, but the one thing that I've really enjoyed, especially in private practice, is that I get to work with a wide variety of people. So I work with kids, I work with adolescents, I have a sprinkling of adult clients in there, people of all socioeconomic statuses, racial backgrounds or ethnic backgrounds. So my work day, my job is never boring because I get to work with a wide variety of different kinds of people and different kinds of presenting problems too. So it's challenging and interesting at the same time for me. Well, definitely what I usually suggest to students is getting a mentor in the field, somebody that you might be interested in working with at some point, somebody that can mentor you and make sure that you're on the right path. There is so many options out there between a master's degree and a doctorate degree, a social work degree, lots and lots of options. Excuse me. So I think you want to do a lot of research before you kind of decide on a career path, so that's a good fit for you, and it's a good length of time for you as well. Kind of depends on what you want to do at the end. If you want to work severe disordered patients, then probably a doctorate in clinical psychology is the path that you want to take, but that can mean a lot of different things. I've had a couple of students just contact me, just looking for people in the community that are psychologists or in clinical fields, and asking me, can we spend some time having coffee and can I pick your brain about what clinical psychology looks like and what you do? And I'm usually more than happy to help students do that. A lot of times too, universities, doctorate programs, master's programs will connect students to professionals in the field as well so that they can have a mentor in the community. A couple different things I've noticed. That I've seen a huge increase in anxiety, both in my adult populations and my kid populations, and I think that's probably a result of things that are going on in our world that are making people anxious and stressed out. The other thing I've seen is a huge increase in technology that psychologists are using both to market their businesses, to market their services. There is a huge push right now to have clinical psychologists use Skype and internet resources to help reach out to people in rural areas where there are very few psychologists and very few resources for individuals. And I'm also using Skype in my practice as well, especially people that have terminated but are moving on to a different state or a different location. They want to stay connected. Well, one of the good things that's happening in psychology, especially clinical psychology, is a big push for evidence-based practice. And what that means is using practices, technology, and techniques in psychology that have been proven in research to be effective for people, particularly for like a specific depression. What kind of practice, what kind of modality works well for treating people in depression, and helping psychologists utilize those services more frequently than a service that might not be as proven or determined to have been as beneficial to that particular struggle. I've certainly enjoyed myself. I know a lot of psychologists that feel like psychology is a great fit for them, especially if they're good at working with people. But I would emphasize again just meeting with a mentor or somebody in the community, in the field, so that you can get your specific questions answered and make sure that this is the field for you